question is, where do you stand on the national health care bill? Some of us have heard it called Obamacare. Where do you stand on that? Are you in support of that or against that? And either way, why? Senator Jones, seems how you introduce health.
Well, first of all, again, I'm for health care. If it's Obama's health care, any kind of health care, I'm for it. I mean, you know, when we get sick, where do we go? You know, I think it's a human thing here that you've got to be able to think about others. You know, I have health insurance. It's not all that I need. I need to have more now. I got some problems. But you know, you can't run out and get insurance after you have the problems. You got to have insurance before. And when you look at these bills out here before the doctor send you back what the customary fee is, you can't afford to pay that. No way can you afford to pay that. Health care is high. High. And you need help. And again, this culture is built on trying to help others. Now, we're doing so much abroad, we need to do a little bit more at the house here. So again, if we can get health care and make sure our citizens are healthy, the same ones they have in the U.S. Congress, and our senators have, and the president have, if they're concerned about their health care just as much as they should be concerned about ours, we should have great health care from our doctors and our providers.
This Affordable Health Care Act, the Obamacare, this is a federal program. But a lot of its implementation is going to be done in the state legislatures. So your representatives, your senators are going to have a big role in determining which parts of those bills are actually adopted here in North Carolina. For example, the healthcare insurance exchange program. That is a state-by-state program where they have, it's a marketplace where individuals, small businesses can come together and negotiate for a competitive, lower price on their insurance premiums. I will fight for that in the North Carolina House of Representatives. Another part of this Affordable Health Care Act, you all have heard about the ban on pre-existing conditions. That's important, for if someone was born with a condition, they had no control over that. That ought not prohibit them from being able to get affordable health care. That ought not send their husband or wife or mother or father into bankruptcy trying to pay these hospital bills. As an attorney, I have a lot of clients that have been injured tremendously in car accidents or hurt on the job. And I see them struggling, trying to make ends meet to pay the hospital, to pay the doctor. Another important part of this health care program that's going to take place in the state is requiring insurance providers to put 80% of premiums paid towards actual treatment and not towards administrative costs or executive salaries or bonuses. I will fight for that in the North Carolina House of Representatives as your representative. Now, I cannot say that I'm in favor of all of the provisions in that bill, but I can definitely tell you that the ones that are going to come down to the state house and deserve some consideration from your senators and from your representatives, I will argue and fight for those ones that I just listed there. Also, I will oppose turning Medicaid into a block grant fund. Right now, we get a certain percentage of all of the costs from the feds. What they're trying to turn it into is you only get X amount of dollars. And whatever is left over, sorry, make it up yourself. I will oppose that in the North Carolina House of Representatives.
I, without hesitation, support affordable health care for all citizens. I've seen how hospitals, small community hospitals, have suffered, and some of them are on the verge of closing because people who have to be seen have no health insurance. And it's a tremendous, tremendous burden on our hospital system to treat people who do not have insurance over and over again. So yes, I, without hesitation, support the Affordable Health Care Act.
Yeah, thank you. Mr. Crawford?
I do support affordable health care. I do not support Obamacare. And the reason is is businesses cannot afford to look after all their employees. What are they gonna do? They're gonna cut back on employees. It's the only way they can keep a bottom line. We can't, again, we've got to have people employed. It's the only way we can afford any of this. It all goes back to jobs. We've got to put people to work. Yes, our seniors need health care. I need health care. I'm sure everyone in this room needs health care. But it has to be affordable for all of us. Not for one, but for everyone. Thank you.